Hey everyone, Dr. Matt Geller here. I'm here with Dr. Andrew Fischer. Some patients are on more budget lenses. Maybe they're not the worst thing in the world, but they're not so good either. How is this? Does this kind of throw a wrench into your practice because this patient's more likely to have problems? Let's say they are having problems.
I think it's very patient dependent. It really depends on the situation and more importantly how compliant the patient is in their contact lenses. I am a very strong proponent in saying that a daily disposable lens should be the first choice, and if it doesn't work out for a comfort issue, I would consider a reusable type lens. If I'm looking for a reusable type lens, it's something that I want to make sure the patient is more compliant in, or as compliant in, which we find in reusable contacts, they're not. We always have these patients that come in and they're in a monthly lens and we ask them, how long are you wearing it? And they say, 6 weeks, 2 months, right? But in certain situations, a reusable type lens I think would be a great lens for a patient. And I really make it a point to educate the patient on risk factors associated with prolonged use past that wearing time, with the importance of digital cleaning if they're using a multi-purpose solution, and different factors that go into that. But I do think we can have great success, but my most important role as a healthcare provider, as an optometrist, is to make sure that I'm providing a healthy lens for that patient.
So the topic of dry eye and contact lenses are almost synonymous. It's so important to address both, and to have a successful fit, you can't have dry eye.
In our clinic, we do a dry eye screening or a quick evaluation on every patient, looking at the meibomian glands and how they're expressing, looking at the ocular surface and the eyelid margin too, and really evaluating if that surface is healthy enough for a contact lens. If it's not, we need to improve it. If you have a patient that's been in a daily disposable lens for 3 years and they've loved it, but they come back in and they're compliant, right? And they come back in and they say, my contacts are dry. Can I try something else? Well, if they've been happy in it before and the contacts haven't changed, their ocular surface has changed.
I see.
So on these patients, we really make it a point to investigate whether it's an ocular surface issue or truly a contact lens issue. Anything that's on the eye is going to affect the ocular surface and how the tears move over it. Contact lens wearers in general have a lower lipid layer thickness over the top of that lens, which makes the patient more prone to an evaporative type dry eye. No matter how good these lenses can be, if we have a very poor ocular surface that doesn't support that contact lens, it's not the lens's fault. We have to figure out the problem with the ocular surface.
Seems like maybe there's more innovation coming down the pike for just dry eye treatment and dry eye diagnosis, which ultimately will uplift all contact lens success rates.
Hopefully, yeah. And I think just talking about it, as we've been around this meeting, everybody's talking about contact lenses and dry eye is the big thing. And so as we start learning more about dry eye and how it affects contact lenses, I think you'll see both of those industries just really blossom. I think it's going to be fun.
We'll have to get you back on in a few years and see where we
please do.
Where we're at then.
Please do.
Thanks for coming on.
Yeah, it was my pleasure.
Appreciate it.
Thank you.